So another piece that I was surprised about when I first got home from the hospital was that they gave me this full list of paperwork, including a list of a whole bunch of drugs that I had been taking. Well, the reality was I reviewed a lot of the drugs with them when I was in the hospital, and some of them I hadn't taken in months or even years, but they're all listed in a big summary sheet. And so when I came home, it became a little bit overwhelming thinking, well, what's the next drug I need to take and when and how? So my daughter put together a really easy to use checklist at a glance. So she basically just highlighted the drugs I actually needed to be taking now. And what was really important is, for example, as you know, some drugs you might have to take with water, a full glass of water. Others might be you need to take food. Others might be, well, don't take it within 4 hours of another drug. Then there's things like, of course, putting on your compression socks versus not. So this simple checklist became kind of a great caregiver guide for either my daughter or my husband who were taking care of me all the time so that they could remember what needed to happen next. And we would just have something easy to follow in terms of the timing of different things. So it's something I'd highly recommend you think about doing. It'll make your life a lot easier just having that simple checklist. You'll see that I also had a basket here of different items, and I put all the drugs in the basket. I also included thermometer, which is something they ask you to check your temperature with on a regular basis. And you'll see that I have some socks here. I'm sure that you've got socks like this if you've had your surgery as well. And I found that when I mentioned it to the nurse in the hospital, she said, oh, I can give you an extra pair of these. And these are so helpful because, again, when I try to get up in the middle of the night to go to the bathroom, I want to be extra careful walking around. So these slid-proof socks were something I wore day and night. Because another surprise that I had was that even though I invested in some really good no-tie sneakers, it's impossible for me to get the sneakers on, at least at this point. And at night, it's just easier to be wearing the socks. So I encourage you to think about getting these, asking them. They'll probably give them to you. The other piece that they gave me in the hospital were some compression socks. And this was another thing that was really good for me to know because I thought in advance that I had to figure out what size I needed and which ones to get. But I found it in the hospital when I asked. They said, no, we can give you a second pair. So they measured it, made sure I had the right kind. And then, of course, you need to use Woolite detergent. You can't use regular detergent. You can't put them in the washer. So you want to make sure to have that handy as well. So you're cleaning these regularly. But again, getting a second pair like this is really helpful and handy. The other piece you'll see behind me is, of course, is the raised toilet seat. And as you know, there's different ways you can get a hip replacement done. And with the class I went to in advance at the hospital, they said, well, if you're getting the anterior approach, you really don't need the raised toilet lift. But I'll tell you that you really do, because again, it's all a matter of you do not want to fall, you do not want to be twisting. And so by getting one of these, you have the benefit of something sturdy to hold on to when you back up. Remember, this is only a two-wheeled walker. There's no locking mechanism that's on it or anything else that keeps it stabilized. You need to have something behind you that you can grab onto. So I would highly encourage you to realize that this is something you really do need just from a safety perspective and plan to invest in that. So hopefully this setup in the bathroom helps you think about different things that you might do so that when you get home, you're not surprised by things that could seem complicated and just sort of emotionally draining. You have an organized approach to help take care of yourself. So now you've just traveled through my bedroom and my bathroom with me, and we're going to be transitioning soon to the kitchen and talking about the surprising things that you're going to learn in terms of eating after hip replacement surgery. But again, I want to remind you that I am just someone who's been recovering from a successful hip replacement surgery. I am not a medical expert, so always make sure to follow the advice of your healthcare team. And remember also, if you're finding that this information is helpful, I encourage you to share it with others, to hit like and subscribe. That will ensure that we'll continue to develop really great quality content that hopefully are going to help you and others as you go on your successful hip replacement recovery journeys.